Yali Madad, everyone, and welcome to episode 2 of the Healthy Bytes podcast. Today I'm joined by my fellow health board members, Dr. Dualshot, an intensive care doctor, and Dr. Iman Velji, a general practitioner, who's going to help me really provide some clarity on the commonly asked questions we get from the Jamaat in relation to the coronavirus. But we were hoping to provide a little bit more clarity on the common questions that we get. So if I can start with you, Dilshad, one common question that we get a lot from the Jamaat is, what can I do to prevent myself and others from getting the coronavirus? What would your advice be to them?
I think the most important thing, which we've probably heard a lot about now, is the importance of hand hygiene. So making sure that we're washing our hands frequently for at least 20 seconds, avoiding touching our face, especially our noses, our mouths. And we know that the virus can live on hard surfaces for a few hours. So making sure that we're maintaining extra hygiene around the house and cleaning surfaces regularly. The other most important thing we can do, which we're now hearing about this week from the government, is social distancing. So this is a way of limiting the spread of the disease from person to person. So for those of you who are able to work from home, avoiding any non-essential trips outside of the house, avoiding public transport, avoiding social gatherings. And essentially that will protect you, but it will also protect the more vulnerable in the society. We know that the virus is highly contagious. So if we limit social contact, we can hopefully limit the number of cases that we see. So stay home, it's difficult, but make sure that you keep in touch with loved ones, especially the most vulnerable in our community, through social media, and make sure that we're all okay and that we're all supporting each other through this period.
Yeah, absolutely. And Iman, another common question that we get from the Jamaat is, how do I know if I have the coronavirus? So what are those things they should be looking out for?
So we suspect that you have coronavirus if you have a fever or if you have a new continuous cough. You may have both or you may have one or the other. And if you do, then you do need to self-isolate. The majority of us will have mild symptoms, and therefore we do not need to contact 111 or our GP. We just need to self-isolate. The minority of us, a small number, will have more severe symptoms like shortness of breath or a wheezy chest. In that case, do go online at 111.nhs.uk or call 111 and get some advice. If you have more severe symptoms, chest pain or difficulty in breathing, then do call 111.
Absolutely. And Dilshad, if a Jamaati member were to get the coronavirus, what should they do?
So if you develop symptoms, you should be self-isolating. Now, if you live at home alone, that means you need to stay at home for 7 days. And if on the 7th day you no longer have a fever and your cough is improving, then that period of isolation is over. Obviously still in, sticking to the whole social distancing, etc., but you don't have to strictly stay at home. Now, if you live with others, there are other members in your household, then household quarantine comes into play. So that's essentially the advice that all members in your household should isolate for 14 days. Now, if they're symptom-free throughout those 14 days, then they can go about as normal, but if not, and they develop symptoms, then that clock resets and they have to isolate for a further 7 days from developing symptoms.
Fantastic. And if a Jamaati member does develop symptoms, such as fever and cough, what can they do about this?
So if they have a cough or a fever, Jamaati members can safely take paracetamol 4 times a day. At present, there are some concerns with regard to ibuprofen, so we suggest taking paracetamol instead of ibuprofen, unless you are already on ibuprofen, in which case then you can continue it and just speak to your GP. For the cough, you can take warm water, honey and lemon, and that is as effective as cough medicine.
And Dilshad, there's been a lot of reference to the high risk groups. Can you provide a little bit more clarity who these people are?
So the high risk groups for whom social distancing measures should be even more stringent than for the rest of us are the elderly. So those aged 70 and over, any pregnant members of the community, and also those with underlying health conditions. So chronic conditions, may that be heart disease, kidney troubles, those with weakened immune systems because of disease or tablets that they take, but can also include other conditions. So if you're worried that you fall within these groups, and you would like more clarity, then feel free to contact a member of the health board and we can give you some advice via the helpline or speak to 111. Now, for these high-risk groups, ideally they should be keeping themselves away from the general population, so the elderly should be isolated on their own, even though that's difficult. And we should be limiting our interaction with them to essential visits only and keeping a safe distance.
Great. And Iman, these are unprecedented times, and with that comes a lot of anxiety, particularly with a lot of media coverage at the moment. What advice would you give to the Jamaat in terms of looking after their mental health as well as their physical health?
So on our first podcast, we interviewed Dr. Zareen Sheikh, and she went through the fresh approach. And I think it's a really good way of just remembering the things that we can do to help us feel better, but also boost our immunity. So the fresh stands for food, which would include eating plenty of fruit and vegetables every day. The R stands for relaxation, so making daily time for relaxation, whether that be through meditation, prayer, or mindfulness. And then the E stands for exercise. So if you feel well enough, then do try and exercise in your home or in the garden. And that can include yoga or gentle stretches, or even putting on a video and dancing. The S stands for sleep. So it's important to have regular sleep times, reduce caffeine intake, and also reduce our screen times, especially for the few hours before bedtime. And that includes the TV, the phone, the internet. The last bit of fresh is happiness. And this is, what can we do to ensure that we are looking after one another? And that means keeping in touch with family and friends. But as Dilshad said, this can be done via the internet, via phones, to reduce the physical distance.
Fantastic. And finally, Dilshad, there is a lot of advice going around, particularly in social media, about certain foods to avoid. What would be your advice regarding?
So unfortunately, as of yet, there is no cure for coronavirus, unfortunately. Treatment is largely supportive when people become ill, and just allowing the body to get over the virus. I've received myself lots of social media sort of snippets, and things such as drinking lots and lots of water will prevent you from getting the coronavirus or flushing it out of your system. Unfortunately, there's no biological sort of way of this happening. So apart from hand hygiene and social distancing, we don't really have any other methods for prevention of the virus. One of the biggest myths, I think, from my point of view, is younger people thinking that, one, they won't get it, and if they do, then the illness is likely to be mild, so they're not as worried about it. What I will say is, yes, the risk of having a severe form of the illness if you're younger is lower, but it still isn't zero. You still have a risk of getting quite sick. And also, as we've heard, there's a severe risk of passing it on to the more vulnerable in our community. So we really all need to take responsibility for our own health, but also for ensuring the health of our family members and others in the community. So please all practice safe hand hygiene and social distancing.
Fantastic, all great advice. that concludes episode 2 of the podcast. I want to take this opportunity of thanking both Dualshot and Iman for taking the time to help me answer these questions. If you do need more support or advice, feel free to contact the coronavirus helpline on 0208 191 0911, or alternatively contact us by email on coronasupport@iuk.org. Hope everyone stays safe, healthy, and we look forward to seeing you at the next episode. Yardım ederim.